Welcome to our video on the causes of heartburn. If you've ever experienced that uncomfortable burning sensation in your chest or throat after eating, you may be wondering what triggers this condition. In this video, we'll explore the common triggers of heartburn and what you can do to avoid them. Heartburn occurs when stomach acid flows back up into the esophagus, causing a burning sensation in the chest or throat. While occasional heartburn is normal, frequent or severe heartburn may be a sign of gastroesophageal reflux disease, GERD, a chronic condition where stomach acid regularly flows back up into the esophagus. Understanding the triggers of heartburn is essential to managing the symptoms. One of the most common triggers of heartburn is certain types of food. Foods that are spicy, fatty, or acidic can cause the lower esophageal sphincter, LES, a muscle that separates the esophagus from the stomach, to relax and allow stomach acid to flow back up into the esophagus. Some examples of trigger foods include 1. Spicy foods, such as hot peppers, chili powder, and curries. 2. Fatty foods, such as fried foods, high-fat meats, and rich desserts. 3. Citrus fruits, such as oranges, lemons, and grapefruits. 4. Tomatoes and tomato-based products, such as pizza, spaghetti sauce, and ketchup. 5. Chocolate, especially dark chocolate, which contains a high amount of cocoa. In addition to certain foods, beverages can also trigger heartburn. Beverages that are acidic or contain caffeine can irritate the lining of the esophagus and weaken the LES. Some examples of trigger beverages include 1. Alcohol, especially wine and beer. 2. Coffee and tea, including decaffeinated varieties. 3. Carbonated drinks, such as soda and sparkling water. 4. Citrus juices, such as orange and grapefruit juice. Other triggers of heartburn include smoking, obesity, and certain medications. Smoking can weaken the LES and irritate the lining of the esophagus, while obesity puts pressure on the stomach, which can cause acid reflux. Some medications, such as aspirin, ibuprofen, and muscle relaxants, can irritate the esophagus and cause heartburn. If you experience heartburn symptoms regularly, it's important to speak with your healthcare provider. They can help determine the underlying cause of your symptoms and recommend appropriate treatment options. In some cases, lifestyle changes such as avoiding trigger foods and beverages may be enough to manage symptoms. In other cases, medications or surgery may be necessary. In summary, heartburn is a common condition that can be triggered by certain types of food, beverages, smoking, obesity, and certain medications. Understanding the triggers of heartburn is essential to managing the symptoms. If you experience heartburn regularly, speak with your healthcare provider to determine the underlying cause and appropriate treatment options. Watch this video to learn about heartburn triggers and how to avoid them.